And the Medicare is single-payer health care. Period. That's it. And it works. And it's been around since 1965. And the other health care that's been around is the Public Health Service. And it's been around since 1911. And it's also single-payer health care. And it works very well. It's on the Indian reservations. And it's, let's see, Public Health Service in poor communities. And so it's not totally... we've been, if you get any of your information off TV, how many people watch TV every day? Wow, that's great. There's not a lot. I compliment you. So anyway, there's stuff that comes on the TV and the media that's misleading us. You know, has anybody ever heard anybody from Canada talk about their health care?
Yeah.
What do they say about it?
They say it's not that great.
They say it's not that great?
They say that the problem that they run into is the fact that they wait too long for outpatient services, and that for even a simple CAT scan, that for back pain, they can't manage to get it done in 3 or 4 months.
3 or 4 months?
Yeah, and they limit the amount of equipment to each city. Like the city of Toronto was running 2 CAT scans. This was as of like 10 years ago, 2 CAT scans for the whole city. So people were backed up. They're running 24 hours, but they were backed up. So they said, when we said, they said we were lucky to have it.
Yeah, because it's non-critical care, so...
But they said we were lucky with what we had.
If you have non-threatening stuff happening to you, but pain is critical, right?
I got up to 4 years and got my wife's medicine acting because it's less than half the money a year, and I have to have it signed by that don't work. But I have to have it signed by a physician up there once a year. So you take your script up there from the doctor here, and this last time I went in the office with my wife, and on the walls this piece of paper stating something like, according to the laws or the rules of medical treatment up here, I can talk to you about one problem at a time. If you have several problems, you pick out the worst one, and we can talk about it today. I cannot talk about more than one problem. Of course, you can have as many appointments as you want, one a day. So that if you have another problem, you make another appointment and come back the next day or the next week or 2 weeks from now to talk about a second ailment. And the office where they were sitting, there were 6 doctors on the wall. The office, well, I'm going to say it was in a building, an old building. Nothing like our clinic over here. It was probably, the hallways of course went down, but the waiting room was maybe 15 by 15, maybe 15, 16 chairs. People sitting, filled up. There's wheelchairs up and down the halls, people sitting on the floors in the hall. 3 ladies talking. She says, if that effing doctor don't take care of me today, shit's going to hit the fan. And they're sitting up and down the hall in this old rickety building, and that's exactly what it was. They'll take care of one thing at a time. He has so much time with you, and you're out the door.
But you do get to talk to a doctor?
You get to talk to the doctor for, what, 5 minutes maybe, and he'll walk out the door.
He don't answer any more than that.
He'll walk out the door. You talk to a doctor, all he has to do is sign mine, so don't take very long.
But when you talk to him, you get consultation?
You don't have no time with him.
Oh, yeah.
He has so much time, and he'll walk out the door. In our case, all he had to do was sign the script.
Okay. Prescription.
Yeah, it's so that I can take it to the pharmacy up there and get it filled. And that's the Canadian law. When I take a script up there, I have to go to this doctor, and I sit down, and I have it signed by him, and I'm out.
So is it your doctor?
No, it's a Canadian doctor.
Okay. But I mean, if you're in Canada, you get to pick which one.
Well, no, you go to the pharmacy, and they'll say, now there's a doctor's office right around the corner.
Oh, okay.
And you go there, and this is what they have for facilities.
So that...
I mean, they're sitting up and down the hallway.
So you got that service
the hallway out here?
You got that service as an American in Canada?
I don't think it.
You're from Canada, right?
No, I'm from the U.S.
But you went to Canada
Yes,
to get
not to get health care.
Okay.
To pick up the medicine. It costs less than it's... less than half of what it costs right down here.
Wow. Well, there's another thing about healthcare. But does anybody else have anything, or maybe you want to?
I think this gentleman's experience points out one thing, and that's that anything that you get from socialism may possibly be cheaper. Usually it's not. Usually the quality nosedives. And that's what he's pointing out.
Okay.
And the bad part of it is Canada's healthcare system is one of the good socialized medicines. Now you get into the ones in Western and Eastern Europe, and it really is.
Shall I just read this a little bit? Or go ahead.
Did you say Medicare works well? Did you say that?
Well, let me hear how it doesn't work.
It's going broke.
Well,
it is broke.
That's
Pardon
true.
me. It isn't going broke. It is.
That is actually, you're right. That is the problem that Medicare has, is it's broke. You're right. It doesn't get funded. Okay.
It's also security.
But there are
The trust fund.
That's the only problem with Medicare is that it isn't being funded.
That's not true.
No?
It's funded. It has nothing to do with being funded. It's overused.
Oh yeah.
Okay, you're using a tragedy of the commons here. It's an economic term that means, when you've got people that are, provided for by a government-run system,
That's it.
everyone's going to overuse it.
You give
Not
something.
not only that, but you lose your sovereignty. That's the thing about healthcare reform, is that it really has nothing to do with healthcare. Control. It's got everything to do with control.
You give something to somebody who nothing.
We'll get more into that when
Let me read just one more piece here. This is good because I've been studying this stuff, and there's points of view, many points of view of it, and it's important to look at all of them because we're screwed right now. At least in my, anybody disagree with that?
I agree we're screwed, but I don't think you put it in the government's hand is a good thing to do.
Well,
I agree.
If the only way I'm going to put my health care.
Well, whose hands are we going to put it into?
I believe smaller. Let's manage this hospital. Let's find a way to make this hospital work.
I like that idea because we were thinking, how about state health care, on the state level?
Like Massachusetts said.
Yeah,
that's
and then we can get into, there's another thing I was going to bring up, but it's related to another topic. But that is, there's a state bank in North Dakota that had a surplus this year. It had it, and if you have a state bank, has anybody heard of CAFR? A Comprehensive Annual Financial Report. Has anybody heard of Walter Burien? Well, the thing is that there's a report, a Comprehensive Annual Financial Report, that every municipality, every government entity has to file. And most of the times they don't want us to see it. But what's in this Comprehensive Annual Financial Report is a slush fund that every municipality, every government, state government, local government has money on the side to be able to handle emergencies and problems. But they're locked in by laws that they can't collect interest on this money. And it's in California, it's $71 billion that is in this locked up financial fund. And guess where the money is deposited? Anybody want to guess?
Federal Reserve.
Wall Street. You're right, exactly. And foreign countries. And this is probably one of the biggest outrages that is going on. And it's very complicated because it's financial gobbledygook. But anyway, if you have a state bank, this money could be deposited in the state bank instead of being in Wall Street banks, and then you can collect interest on it. You can loan it out to people within your state.